Now it's time for On Point, where we speak to experts to delve deeper into the big news stories of the day. Those in the spotlight right now, of course, is COVID-19. And South Korea's daily COVID-19 cases dropped under 1,500 on Sunday, but the tally remains higher than a great many people had hoped, especially with all the vaccinations going on. Does this mean this fourth wave is likely to stick around, even as the country's vaccination rate for adults has surpassed 70%, as we just heard from our Chairman Jung? Also, could this potentially impact the move to living with COVID-19?
To get answers to that question and other news related to the virus, we connect to Dr. Alice Tan, internist at Ms. Mary Women's Hospital in Seoul. Good morning, doctor.
Good morning.
Now let's start with South Korea reaching its goal of 70% vaccination and possibly surpassing 80% this month. Now, given that, why do we continue to see the daily caseload being relatively high, and could this prompt the government to reassess the timing of its move to the COVID-19 scheme?
Well, certainly one factor is the Delta variant. Over the course of the last 6 months, when the Delta variant was first detected in May, it's now at the point where 100% of sequenced cases in Korea are of the Delta variant. And of course, we know it is highly infectious and also very virulent. So when we have the combination of a widespread variant, such as a Delta variant, and also a large pool of people who are still not fully vaccinated, when we tally up the number of people greater than 50 years old who are still not fully vaccinated, it comes to 1.63 million people. And also you have a high degree of social activity. If you go to any restaurant or retail space, it's actually pretty crowded. That combination is what's going to lead to the double-digit deaths that we've been seeing, and also the number of daily cases greater than 1,000.
Now, Doctor, there has been this big controversy over booster shots for people who got the Johnson & Johnson Janssen vaccine. They have had the most breakthrough infections among fully vaccinated people. Now, a study in the United States also showed that that particular vaccine's protection drops off really sharply, even after just a few months of having it. For those who've had the Johnson shot and might be listening, do you suggest they get a different vaccine, Pfizer's or Moderna's, when they get a booster?
Unfortunately, there have not been data that are sufficiently, we say, powered to be able to make a recommendation and say that one combination of prime boost after an initial Johnson & Johnson vaccine is better than the other. However, the US FDA and the CDC have recommended that for people who receive the Johnson & Johnson vaccine, they should get a booster 2 months after the initial shot. In terms of which vaccine to use, they really left that open to either an mRNA vaccine or another dose of Johnson & Johnson. But from a practical perspective, in Korea, about 1.5 million people have received the Johnson & Johnson vaccine so far. In Korea, there are just a little less than 200,000 doses of Johnson & Johnson left, whereas there are 15 million doses of a combined mRNA vaccines. And so from a practical standpoint, it's probably going to be likely that if a person has received the Johnson & Johnson vaccine, the booster will be with an mRNA vaccine. The limited immunogenicity data seem to suggest that there are higher antibody levels when the Johnson & Johnson is followed by an mRNA vaccine. But as I said, the studies were very, very limited, and it's hard to draw firm conclusions.
But there's also heated debate about breakthrough infections.
Boosters and also increased social restrictions, but I would hardly say we are out of the woods. Only 34% of our total population has received a third shot booster. And although these restrictions and the widespread deployment of boosters has buffered the spread of the Omicron variant, what we're seeing is a troubling, nearly daily doubling of new community sporadic Omicron cases. The number is going from 1 to 11 to 25 to 43 new sporadic Omicron cases. So I think that we will start to see a new surge either next week or starting in mid-January. Hopefully, it will not lead to the kinds of hospitalizations and deaths that we saw during the month of December. But I think it's coming. I don't think it's something that we can avoid.
And turning to these vaccine passes, what are your thoughts on the fact that they're only going to be valid for 6 months now after the most recent shot or the booster? And do you think this will be a temporary measure, or do you think this is something that's going to become permanent?
Well, according to recent data from the Imperial College of London, 2 shots of the AstraZeneca or the Pfizer vaccines offer only 0 to 20% vaccine effectiveness against infection from the Omicron variant. There is higher level of vaccine effectiveness against hospitalizations, but basically 2 shots are not enough to protect against the Omicron. So at some point, when the overall risk due to COVID in our country becomes very, very low, at some point we will no longer need this vaccine pass system. But it's very hard to predict when that will come. We don't know if there will be a next variant of concern similar to Omicron that requires us to have another, say, 4th shot of a COVID-19 vaccine. And so for the time being, I think it does make sense to have an expiration date on the vaccine pass after 2 doses, because it's not going to be enough to protect against Omicron.
So, Dr. Tan, what would you like to say to those people who are unvaccinated and who were fully vaccinated but are hesitant to take their booster shots?
Right. So first of all, to the around 7 million people who have not even started vaccinations, COVID will probably find you. And it's not a benign disease, even though Omicron does seem to lead to fewer hospitalizations. It's not a benign disease. It still leads to ICU cases. It still leads to people on ventilators, and it can still cause death. The vaccines are safe. 3 shots of the vaccine does seem to protect against Omicron. It certainly protects against hospitalizations against even Omicron and the Delta variant. So please help our country get back on the road to the return to normal by starting vaccination, because otherwise COVID will find you. And it's not just acute COVID that we're worried about. Long COVID, long haul COVID can be a very debilitating condition. So we want to try to avoid that as much as possible, and vaccines are the way out.
Right, and PCR tests have been improved here in South Korea. We reported on it just last week that now they can detect all 5 variants, including Omicron, and they can do so much faster. But are we still seeing the majority of new cases here in South Korea being the Delta variant? And for people who may have already had Delta or previous variants of COVID-19, can they still contract Omicron?
Right, that's a very good question. So far, Delta is still the predominant variant in South Korea. But as I said, we are seeing more and more sporadic community cases pop up throughout the country. And I think that's the most troubling thing, is that the hotspots seem to be in the provinces where the healthcare systems may not be as robust. In terms of when will Omicron become dominant? I think it will happen sometime in January. The Omicron variant does seem to evade even natural infection. So having had a prior infection of COVID-19 will not protect against the Omicron variant. However, perhaps the good news is that infection with the Omicron does seem to protect against the Delta variant. But we can't say that Omicron will protect against the next emerging variant that, the next emerging variant X that we haven't identified yet. And so that's why even if you've been infected, you should definitely get vaccinated because that will help protect you against both infection and also hospitalization.
So, Dr. Tan, before we let you go, let me just ask you this. We know it's hard to make predictions, but do you have some optimism that the year 2022, we're going to see some things getting better in terms of COVID-19?
Yes, I do think that the impact of COVID-19 in our lives overall will decrease. I have high hopes for the oral antiviral pills that should be available hopefully sometime within this month. But there's just too much of the world that has not even received a first shot of a COVID-19 vaccine. And then the high levels of transmission that we're seeing in Europe and the US, that just means that we'll see more variants. That's almost inevitable. So although COVID will be, I think, less of a deadly disease as time goes on, I'm not sure that 2022 will be the end of the pandemic. I hope so, but it doesn't look likely.
Okay, Dr. Tan, a bit of a pessimistic note to end, but thank you very much for your insights as always. We appreciate you coming on. Thank you.
Thank you.